Hello, welcome to another episode of Nursing Ideas. My name is Rob Fraser. Today I'm very excited to introduce Judith Shamian, who is the current President and Chief Executive Officer of the Victoria Order of Nurses and the current President-elect of the Canadian Nurses Association. And she has an amazing career of leadership and involvement in nursing. And could you give people maybe like an elevator ride pitch of kind of where you've come from in nursing and where you are now?
Sure. It's a pleasure to be with you today, Rob. And I basically a diploma-prepared nurse. I did my nursing in Israel a long time ago, and then moved to Canada and have taken an undergraduate degree in Concordia University in Montreal, a master's in public health and international health in New York University, and a PhD in nursing management in Case Western Reserve in Cleveland. On the clinical side, I worked as an emergency room nurse, I worked as a community nurse, I worked as a neurosurgery nurse, and then had an injury which prevented me from continuing clinical work, and moved into management. Did some infection control and then moved into management, and in management have done managing of overseeing some units, been a director of nursing research in Sunnybrook for a few years, was vice president nursing at Mount Sinai for 10 years. And then I opened the Office of Nursing Policy at the federal government at Health Canada and did that for 5 years. And for the last 5 years, I've been the president and CEO of VON. In between, I've been on faculty, and I am on faculty at University of Toronto. I've done a lot of research, published, and had great fun in being a nurse.
Yeah. And what are some of the particular research areas that you've really enjoyed kind of working in? And what type of projects, just so people have an understanding, have you been involved in?
My research always was related to my various management jobs. And they always emanated from questions I had and not finding enough answers in the literature. So for example, when I started my nursing management career at the Jewish General in Montreal, my work was on primary nursing because that was the care delivery model that talked about, and we were interested in it. So we implemented it and evaluated it and looked at it in that context. And more recently, and a lot of work that I have done in the last 15, 20 years had to do with workforce issues, with the role of the registered nurse in acute care setting. And I have worked with Linda Aiken when she did her international study, and done a lot of work with two incredible nurse scientists in this country, with Dr. Linda O'Brien-Pallas and with Dr. Heather Lashinger from University of Western Ontario. And they both were fabulous in the sense that I was a vice president nursing at Mount Sinai at difficult times in healthcare. And I had a lot of questions of what's the best way to lead and manage. And there was limited literature, and the literature that was there was from outside of Canada, and we needed Canadian literature. And they both worked with me looking at workforce issues and care delivery issues, and the research and the results of the research have really helped me to shape the practice.
And looking at workplace issues or questions of staffing skill mix are not simple. They're very complex and challenging questions that I'm sure fall in line with a number of other complex issues that are being struggled with by management every day. How did you decide that you wanted to take on research? Because I'm sure many nurses have questions, but were you encouraged by anyone else? Was it kind of personal motivation that you thought you'd take it on? And what steps did you take to start to learn the skills that were required for pursuing that research?
That's an excellent question. And if I really go back to the beginning of days, when I was doing my undergraduate program, one of my professors was an epidemiologist who was doing some research at the Montreal Children's Hospital. And I volunteered to work with his research team. And as an undergraduate student, it meant that I did data collection. Mm-hmm. And that was great because I learned data collection. And then I graduated to do data entry. And that was wonderful. But it really helped me to understand that I was interested in learning and exploring and knowing the truth in knowing how to shape any decisions. So when I became more involved in management, and then that was the questions that were driving me. But as an executive, as an administrator, I really didn't have time to write a proposal, to gather the data, to enter the data, to analyze the data, to write it up. And I turned to scientists whose bread and butter is the research, and we collaborated. And the beauty of it is that you take your experience as a manager, as a leader, as an executive, you describe your problems, and you work with the researcher who turns it into a research project, but they also benefit of being able to see the work environment and learn from it. And then when the finding becomes available, a couple of things happen. You first of all can make more evidence-based decision, but then you also start to push policy. Because it's not just good enough that I change my own management scope like it was at Mount Sinai, but pushed the policy, whether it's with government and others. And there was at that time in the 90s a lot of discussion around skill mix and other things. And the research and the experience and the collaboration helped to make decisions that are good for patients.
And so part of that sounds like you were fortunate enough to get involved early in research, but for people who might have missed that and are a bit further on in their career, how can they go about kind of building those collaborations with researchers or getting a bit of research experience? And for nursing students who maybe are thinking about research opportunities or getting involved in research, any suggestions for what you think might be kind of interesting now for them to kind of take a look at for getting that experience or involvement?
In most of the universities, I know at least in Canada, we have nowadays a significant number and amazing nurse researchers. And my first step would be, as an undergraduate or a graduate student, is to find out who is doing what research and knock on their door and ask them if they're looking for a research assistant, or if you cannot get a research assistant job, which would be nice to get because you also get paid a bit, ask if you can volunteer. And if all that doesn't work because there are 20 of you interested in one position, remember the university or the college you're involved with is pretty extensive. And it doesn't make a difference if you do research in nursing or policy or other field that's not related to nursing. It will help you to learn the skills and be with a group of people who carrying out research, and you learn about the research mentality. Of course, it's more interesting and it's more exciting to do something that close to your heart. So if you're interested in mental health or maternal child or other areas, it's fun to do that research. But you're looking at taking baby steps. And you join a team and you work with them, and then you learn about yourself, whether it's something that is interesting to you. If it is interesting, then there is no question that you need to consider graduate education, both master's and PhD, which is really the beginning training for research. To become an expert researcher is a long journey, but it's a fun journey because you always learn and explore. So there is that notion of discovering, you know, it's so it's very interesting. And if you show interest and you express that interest and inform others, opportunities happen. And even in the small scale, if you are a member of your student association and you want to do an assessment of what's the interest or how satisfied they are, you start to develop a small survey. And all of those things are starting to give you the tools of what research is about and how you can proceed. The other thing that we shouldn't underestimate as a student is that hopefully today's learning is very much about evidence-based. And you read a lot of the journals and the research magazines and so on. So you also develop an appreciation of what are the skills and what's the science and what it takes to develop research.
And just touching on the first part of that question, for the people who might not be kind of just entering their nursing career, how could they kind of either get involved in research collaborations? Is it the same kind of? And for students who are listening to what Judith has said, I really would encourage you to get in touch and speak with professors or people that you respect in the field, because even if they don't have opportunities for you now, they are experts in the field, so they know where the opportunities sometimes are, and they can give you advice on how you could immerse yourself in a topic or a research area that you're interested in.
So let me go to your question around those that have not engaged in it when they were in school. My comment would be that not every nurse will become a researcher. And please, we don't want every nurse to become a researcher. The patients need us. But every single nurse should be a user of research. Mm-hmm. And there is a lot of discussion today about KT, knowledge transfer. And that's where I think every nurse, whether you are diploma prepared or you are a nurse practitioner or you are a PhD prepared and you work in administration and leadership like myself, have to have an ability to do a knowledge transfer. So you understand what the research says, you ask yourself, what does it mean to my practice, and how can I transfer that knowledge? And if you look at work that RNAO has done, evidence-based practice, the clinical guidelines, RNAO is the Registered Nurses Association of Ontario, yep. Or if you look at other organization best practice guidelines and so on, there is a lot of research synthesis that has been done to provide knowledge that can help us to strengthen our practice. So there are a lot of people and a lot of nurses who say, no, research is not for me. And that's absolutely fine. But no nurse can say, I'm not interested in knowledge generated through research. Mm-hmm.
So that covers some of the kind of research aspects of what you're doing, but now to move a bit back to the leadership topic and aspect of what you're doing. Can you explain a bit about, you told the story of how you ended up at VON, but what is actually involved in running an organization of that size? And you explained in your presentation that you think it's important for a nurse to be at the helm of such an organization. How do you kind of explain or teach and develop nurses to get to that level where they can take on such a massive responsibility?
I often joke nowadays that after I have been running VON for 5 years, I can go and run any of General Electric or GM or Chrysler's or any of those organizations. And I guess the point is that you need skills that are uniquely management and business-like skills. So to run a major organization, whether it's a hospital or a VON or a government or a private organization, you first and foremost, if you're in the healthcare or in the situation like VON, which is a home care organization, you have to understand what's the purpose of the organization. Mm-hmm. And that's where the leadership comes in, and have a passion of understanding it from the bottom up and sideways. So I spent the first 4 or 5 years with the organization, truly knowing what's going on, what are the different programs, who does what, how it's get delivered. We also deal with a lot of policy issues, but that's for later on. That's not immediately relevant to the question. But then you also have to understand how the organization works together and gets integrated, and how you lead to success. And in VON, we have 14,000 paid and unpaid staff. We have 9,000 volunteers, and we have 5,000 staff.
Judith is very important, so people need it right now.
I apologize. That's my cell phone that I forgot to shut off.
It's fine.
Managing 14,000 people, it's not a picnic. In addition to it, those 14,000 staff, volunteers and paid staff, are all over the country in over 1,000 communities. So you get the geographic distribution. It's not even like a health authority that you can take the car and get to from one side to the other side of the health authority in an hour and a half. You really have to commute from BC to Corner Brook in Newfoundland to kind of crisscross one way the country. So there are a lot of layers of complexities that go into employing, hiring, paying, union negotiations, information management, other issues that go into, even if you take out the clinical components, which is a challenge and a big component on its own. And when you run such an organization, and if you are a clinician executive, so I come into the position as a nurse that has a lot of other management experiences, I understand the business of healthcare. But I also need to understand the business of running a business, running an organization, that you have to make sure that you generate revenue, not because you want to give the profit to stakeholders, but because you have to pay salaries. If you don't bring in money, you can't pay salaries. If you don't bring in money, you cannot do the charitable programs that we do. And we subsidize, whether it's Meals on Wheels or Friendly Visiting or all kind of other programs that Canadians badly need. Mm-hmm. So in order to be able to be a CEO of an organization like VON, which is totally different than a hospital or a health authority, you need the very, very strong analytical, financial, executive management skills, and I believe very, very strong professional understanding of healthcare and healthcare system. And it cannot sit in two separate people. So you shouldn't have a CEO that is a brilliant MBA graduate who knows everything, can look at the balance sheet and figure out the problems, and then have maybe a chief nurse who knows all of the business. When you merge the two together, the professional and the business component, you're able to provide a kind of leadership that is very, very different and far more powerful for the benefit of staff and the benefit of the patients we serve, than if you separate the two.
Yeah. And now you're using the vast experience that you have to benefit students by coming to conferences like this. Can you explain why you're starting to do that and the importance that it has to you?
Yeah, absolutely. And if you look at my resume, you will see that I crisscross the country for presentations, and my office often laughs at me because I say to them, okay, I am so overcommitted for the next 6 months, we're going to say no to every invitation that comes in from now on. And an invitation comes in, and if I happen to see it, I say, maybe I should do it. Just because each one of those opportunities are opportunities to contribute to other people to think. You can be amazing, and Rob, you are amazing, you're making a difference, you are a student, you are working in different settings, but by doing what you're doing, you are pushing out the exposure to many hundreds of more people that you couldn't do on your own. Mm-hmm. And that's exactly the philosophy. So the fact that I can speak to a group of 500 or a group of 20 students or nurses or healthcare executives and share some of the issues and the concerns, multiply, taking out those messages and trigger the environment. So if you are a leader and you want to influence change, or you want to strengthen certain things to happen, you do it with other people. Mm-hmm. And the more circles, it's like throwing a stone in the lake, the stronger or bigger the stone, the more circles you generate. Yeah. And the more I go out and connect and discuss things with individuals and groups, the further hopefully we will advance the agenda.
Okay. And one of the interesting things that I thought you talked about right at the very beginning of the day was the importance of nurses being leaders. And you said, once you are a nurse, you are a leader. And can you explain to people who are in nursing school or who are working clinically or doing different types of researchers who don't feel they're maybe exposed to the public or in places of leadership? So what do you mean when you do these workshops and you're saying that? How can people make those ripples if they're not in a leadership position?
So to me, leadership meaning that you take what you know and what you experience and the expertise you have to influence and make it better for somebody else. So if you take a nurse who has 8 patients, and she goes in or he goes in and use the knowledge and the experience and the expertise and provide a guidance to the patient and the family, you provide leadership for that group of clients. It's clinical leadership, but it's also life-changing leadership. Because most of the patients we see today in most of the hospital settings, and definitely in the community setting, are older adults.